just down at their feet, person's feet, right? And we just make some nice contact here. And then we're going to scoot up at their calcaneus and just lean back. You notice how my arms are extended, right? And again, if this is not comfortable for you kneeling, you can sit down on the ground. But the important thing is, along with your intention, how your arms are extended, right? And it's your body weight doing the work. And then that traction is just really nice. I'm going to put the legs down. I'm just going to do a little movement of the feet. So I'm just doing some simple squeezing. And then we're just going to rotate the legs a little bit just to see what the range of motion is. So you notice now I'm up above the work and my arms are still extended and I'm just leaning in. So you see the simple movement, how it's starting to open up the knees and ankles and hips. Come back. And inhale, and on the exhale, let's pull back the other way. Easy. And I'm going to put one foot over the other and press down so you get some nice openness in the retinaculum of the ankle. Feel? Feel stretch. And switch. Little toe pulling. In Chinese medicine, they say that the energy gets stuck in the joints. So that's why we spend so much time with traction and opening the joints. The joint seems to put up the most resistance. And then we're going to focus on one leg. So I'm working here on her right leg, and I'm going to stick my right leg underneath hers. So it's supporting the knee, right? And you'll notice when I'm sitting like right in line with her leg, and I have some room between the plantar surface of her foot and my torso. So there's room for movement of the foot. So we're going to start by some traction. Again, utilizing my body, right? And I'm going to come back in and then just do some nice range of motion. One way. And notice my body is moving with it. One way, the other. And I'm going to do some rotation of the foot. One way. Switch hands in the other. Of my hand to compress down into the soft tissue of the leg right above the ankle. Pressure's okay? Press. And use my thumbs just to sink in here, just to apply a little pressure, loosen up the musculature, also this opening up the lines of energy that run in the inside of the leg. Pressure's okay. Leaning in on my exhale. I'm just leaning in on the exhale. Up to the knee, and I'm going to bend the leg. Figure 4. And add a little compression to stretch, a little stretch of the abductors, a little palmar compression. If you're working on someone, and we've all had this experience where you're working on someone and you put their leg in figure 4, but because of the tightness here, your knee's up here. So in a situation like that, you don't want to press down so much. But what you can do is either put a pillow, or I have no pillow. Neat. Neat. Then you could use your forearm. It takes the pressure a lot easier, and then you can use your body weight. I'm right over the work, so I can just sort of sink in. Okay. Then here. So from here, I'm just going to foot's right on the mat, and I'm going to sit down right behind it. So I'm positioning the foot so that I move the heel as close to the gluteals as possible. And I'm sitting myself in figure 4, and this foot is just going to go right on the top of the toes just to stabilize the foot. And I'm going to intertwine my fingers above their knee and inhale, and on the exhale, as I lean back, you notice my arms straighten and then my body weight. Now look at that stretch in our hip. I'm just going to work down. Back up. And move the foot away. Still stabilized by my leg. And now I'm going to take my fingertips and I'm going to curl them right in between the gastroc heads. A lot of tightness happens, a lot of fascial binding because of the two heads. They bind towards the midline of the midline. There's also an energy line that runs right through here of the bladder meridian. So I'm coming right with my, not the tips, but my pads of my fingers, and I'm just leaning back. So it's the body weight. And I'm just going to work and take that right between the heads, right down to the Achilles tendon before it attaches to the calcaneus. Pressure them. And I'm going to end with a little squeezing. So I use the palms of my hands with my fingers interlocked. Put a little squeeze on the calves. So I'm just pulling it away from the bone. It's like pulled pork. Look at how nice it comes off the bone. Nice and tender. It melts in your mouth. Okay. And then we're just going to end this sequence with a little foot compression. So the leg just comes up, and I'm going to use my outside foot right into the hamstring. Notice my leg is extended, and I'm just going to compress. So I'm straightening my leg, pulling here, nice compression in the hamstring. You get down about that far, you have to switch. So it's the balls of your feet. Take it down. If the balance is rough for y'all, or their leg isn't comfortable that way, an alternative for compressing into the hamstrings is simply this. Let the leg fall out. Stabilizing both feet here. Pressure's okay. Same intention, same effect, different approach. Okay? And then you would just do it to the other leg, same.